Good morning, South Africa, and welcome to True State of the Nation, where we take an honest look at what is happening in our country. Today I would like to talk about another bill that the ANC is forcing through Parliament, and this despite common sense suggesting it will lead to disaster. And that is the NHI, or the National Health Insurance Bill. On Tuesday, the ANC forced the bill through the National Assembly, with 205 votes for and 125 votes against from the opposition parties. Now, the first thing I want to say is that the stated goal of the NHI is a noble one. The idea that every South African should have access to quality healthcare despite their financial situation is without a doubt the right idea. Nobody should ever die or suffer because they don't have money. So I fully support the idea of every South African having access to proper medical care. What I don't support is the ANC destroying private and public healthcare to secure some votes and enrich themselves. As Michelle Clark, the DA's Shadow Minister of Health, wrote in an open letter to the President, Mr. President, I understand that the 2024 election is looming ever closer and that the ANC has nothing tangible to offer the electorate. There is no hiding behind fancy words or phrases, Mr. President. We all know that the NHI is a last-ditch effort to fool the public into thinking that the ANC actually cares, and that despite years of horrendous abuse, this time it will be different. There are many problems with the NHI bill, and the first is that South Africa already has universal healthcare. Any person can go for treatment at a public health facility. So as I said, nobody should ever be denied healthcare because they can't afford it. And if the public healthcare system that already exists worked properly, they wouldn't. So the problem with public health is not that we don't have universal care, but that it has been completely destroyed by the ANC government. Yes, this public healthcare is terrible, but that is in no way because of private healthcare or the people who have health insurance. However, the Minister of Health insinuated that private healthcare is in some way stealing money from public healthcare. He said, access to quality health service has been a casualty, with those who have private medical insurance consuming 51% of the national spending, while constituting only 16% of the population, while 84% depend on 49% of the resources from the fiscus and services provided by the public health system only. But that is disingenuous and misleading, because private healthcare is funded with private money, and as a free trade economy, South Africans should have the right to purchase better healthcare if they want. Private healthcare is not taking money from the public health system. If anything, it saves public money by reducing the number of patients. The private healthcare system is a result of the ANC creating a corrupt, dysfunctional, understaffed and ill-equipped public health system and forcing those who could afford it to seek alternatives. Now, it's the responsibility of the state to provide public health care, not individuals. And don't forget that taxpayers already fund this universal health care in South Africa to the tune of 259 billion rand a year. But this money is misused and stolen, and the result is a collapsing public healthcare system, courtesy of the same people who have collapsed the public electricity system, the public rail system, public water system, the public post office, the national airline, and almost every municipality in the country. But the ANC is incapable of taking responsibility for their failures, and instead of getting their own house in order and sorting out the public health system, they have decided that the solution is to steal money that has been paid for private healthcare, stick it in a big pot along with the existing budget for health, and call this universal healthcare. The Minister of Health said, "Honourable members, in simple terms, what the NHI seeks to do is stop the two trains, that is private health and public health, travelling on parallel tracks, but both surely going towards crashing, while if they can be pulled together, there is a good chance of complementing each other." But in truth, public healthcare has already crashed, and so the ANC is now attempting to hijack the private healthcare train and force people to give them their private money in exchange for a complete loss of freedom over their own medical choices. As the DA Shadow Minister of Health wrote in her letter to the President, the ANC seems to be labouring under the illusion that South Africans would happily shell out extra money for an already crumbling public health system to be further overburdened when nearly 9 million individuals with medical aid would have to compete for services under universal healthcare. How can you honestly expect those 9 million South Africans to forfeit their medical aid and then proceed to fund the private health sector without any apparent benefit to them? One day they are receiving immediate medical attention in a private hospital. The next day they are required to travel further away to a public hospital which does not have any beds, sufficient staff, and a waiting list of several years for certain surgeries. It is simply not reasonable. But the NHI will now pool private money along with tax income to provide everyone with the same level of healthcare. But will it work? And what will that level be? Let's ignore corruption, maladministration, and incompetence for a moment and just look at the numbers. Currently, the government allocates 11.6% of the national budget to public healthcare. In this financial year, that equates to 259 billion rand. This money goes to providing healthcare for around 50 million people. In 2021, private medical aids paid out 205 billion rand in benefits for the healthcare of 9.7 million people they covered. So in 2021, individuals covered by medical aids received an average benefit of 21,152 rand each for the year, while the benefits in public healthcare was only 4,878 rand per person. So let's assume the government still provides the 259 billion courtesy of the same taxpayers who are also paying for medical aids, and then add the 205 billion it steals from private citizens who pay their medical aid. And I say steal because nobody is going to willingly pay the same amount or more for public health services as they do for private. The government will need to make this mandatory. In other words, taking our money under the threat of penalty. Nonetheless, this money all pooled together would mean that the NHI will have a budget of 464 billion rand per year to serve the health needs of 60 million people. That would equate to an average benefit of 7,733 rand per person, a far cry from the level currently offered to medically insured people. So the NHI might provide all South Africans with the same level of care, but it will not be a level that raises public health care to the level of private, but rather pulls the level of all health care down to the level of public health care. When I asked a surgeon about the NHI, he said, yes, we will all have the same health care. None. To provide the same benefit of 21,152 rand per person per year, the NHI would need a budget of over 1.2 trillion rand a year, 3 times more than is currently spent on public and private healthcare combined. To provide this equivalent private healthcare benefit, the NHI would need 105,760 million rand per month. This means that with 464 billion, the NHI would run out of money by April each year. So far from these two trains coming together to complement each other, the NHI simply puts them on a collision course with each other, and when they crash, there will be no healthcare in the country. Now, those who support the NHI ignorantly argue that similar systems have been adopted successfully in other countries, and so if they can work elsewhere, they can work in South Africa. They offer examples like the UK and Cuba, both which have free universal healthcare. But neither the UK or Cuba's model could be implemented in South Africa. While the UK is a free market economy, it does have a socialised healthcare system called the NHS. Among universal healthcare systems, the UK's NHS is considered one of the best, but even that is far from perfect. Funding for the NHS comes from taxes. This is possible because the unemployment rate in the UK is only 3.8%, so there is a large tax base to draw from, unlike in South Africa, where the tax base is extremely small compared to the amount of people who need to benefit from the collected tax. Our already overburdened tax base will not only be funding the NHI through tax, but will be forced to pay additional fees once spent on private medical aid into the NHI. Only now they will have no control or choice when it comes to their own medical care. The UK also does not have the same level of corruption and maladministration as South Africa does. The UK has a functioning public sector and a far greater level of accountability. Consider that former Prime Minister Boris Johnson was forced to resign for attending a party during lockdown, while our president stuffed millions of dollars in his couch and the ANC simply gave him a free pass. As researcher Andrew Barlow wrote, the NHS has decades of experience to draw upon, an enormous budget, a relatively stable economy, and a managing government unhindered by a retrograde commitment to outdated ideology or a culture of nepotism, rent-seeking and graft. The same cannot be said about the ruling party in South Africa. Moreover, it seems probable when all things are considered that the government is overreaching with the NHI proposals. While admirable, it is simply unfeasible that it will have the capacity to deliver on its promises and implement an effective, efficient, and uniformly accessible single-payer system entirely publicly funded. And even in a first-world country like the UK, with low unemployment rates, funding for the universal healthcare is still a problem. At present, more than 7 million patients in the UK are waiting for procedures like hip replacements and cataract surgery. So just imagine what the waiting period will be in South Africa, a country that takes 6 months to print your driver's license card. So even if the funding for the NHI magically appears without bankrupting the country, it will still be run by the South African government, which in turn is run by the ANC. So do we really want to put R1 trillion a year under the control of people who have stolen everything they can get their hands on for the last 29 years? And then expect them to administer healthcare without any corruption? And if the ANC's history of choosing who to run things is anything to go by, then the NHI will most certainly not be run by experienced and competent people with a proven history in health administration, but by politically connected muppets. If you have ever been to a Department of Home Affairs office, a license testing station, or a public hospital for that matter, you will know that the level of service in our public institutions is appalling, and that in many instances it's incompetent. In February this year, I stood in line for 8 hours just to renew my driver's license card. This is the same type of inefficiency we can expect from healthcare once the government is in control of it. So what about Cuba? The ANC and the EFF love Cuba. It's one of their socialist role models. So why can't we implement universal healthcare the way they have? Well, we could, if we were willing to surrender all our rights and freedoms. The Cubans may have free universal healthcare, but they have paid for it dearly. Cuba's healthcare system is one of the only things in the country that does function, and even so, it's far from perfect. The country often has shortages of everything from food to medicine, and doctors are forced to work without the latest medical technology or diagnostic tools, sometimes even without electricity or running water. Under the communist government, Cuba prioritized healthcare, but not out of empathy, but rather greed. Healthcare earns the Cuban government billions of dollars a year. The Cuban government trains doctors and then hires them out to other nations. However, the Cuban government then keeps between 70 and 90% of the salaries paid to those doctors by their host nation. So hiring their doctors as slave labor is one of the Cuban government's greatest sources of income. And life is no better for doctors and health workers in Cuba. The starting salary for a nurse in Cuba is $25, less than 460 Rand a month. And a doctor with 2 specialties is paid the slave labor rate of $67, around 1,230 Rand a month. So a specialist in South Africa can charge more for a single consultation than a Cuban doctor is paid in a month. It's no wonder that the NHI has caused concern among South African doctors. A survey conducted by the South African Medical Association showed that up to 38% of its members plan to emigrate from South Africa due to the planned introduction of the NHI. South Africa already has a shortage of doctors, and the NHI will make this even worse. Doctors, especially those with much needed specialities, will leave South Africa and be welcomed in countries where they can practice without the burden of the ANC controlling them, and South Africa will be left high and dry, without doctors and without a functioning healthcare system. So it seems like the ANC is intent on destroying South Africa, and the NHI might well be the final nail in the coffin. But let me know in the comments what you think about the NHI, and please subscribe to this channel and share our videos.